This is a group for spouses and partners of trauma survivors, presented by Amy Doyle, Kelly Millard, and Tony Rice. Who are spouses and partners of trauma survivors? For our group purposes, a spouse or partner of a trauma survivor is defined as anyone who is in a committed romantic relationship with the survivor of trauma. The target audience for this group is anyone 18 years and older who is the spouse or partner of a trauma survivor. The group will start September the 1st, 2016, and run for a duration of 12 weeks, with sessions lasting 90 minutes in length. Group members will not be screened, and the group will be open to anyone who meets the above criteria. Members will be signed up on a first-come, first-served basis, and advertising will go out to all local counselors in the area.
Too often, groups focused on surviving trauma are solely for the trauma survivors. According to Waddell and Orr, everyone who lives with a traumatized person is affected and can begin to speak and behave in ways that mirror his or her words and actions. Spouses and partners of trauma survivors can become affected by their spouse's or partner's trauma, and we have decided that they could benefit from having a group focused on them. A group for spouses and partners of trauma survivors can accomplish 3 goals. It can provide education on trauma, surviving trauma, and the effects of trauma. 2, because the focus is on the spouses and partners of trauma survivors, the spouses and partners will find a safe place to explore their own mental health and well-being amongst others with similar experiences. The last goal can be achieved through the achievement of the first 2 goals. Once spouses and partners have learned more about trauma and devoted more time to their own well-being, they will become better, stronger support systems for the trauma survivors in their lives.
Topics that will be addressed in group will include trauma and how it affects the survivor, current trauma research and treatment, compassion fatigue, coping skills, how to positively affect partners and spouses' betterment, side effects of surviving trauma on relationships, setting healthy boundaries, self-care, and personal growth. Handouts will be provided for each educational topic discussed in group so that participants can review them at a later date. These topics will be given emphasis, but group members will have the opportunity to explore topics that are meaningful to them. Each week after the group leader has presented the educational topic, there will be time for group members to discuss and explore the topic together. Members will be given time to share ideas of how they can best apply the subject discussed to their own lives and situations. In closing the group, the leader will summarize what the group talked about, assign homework if necessary, and offer encouragement and hope.
The following are some observations we had of our group. Partners tended to be more comfortable discussing the actions of their survivor, but had difficulty presenting their own thoughts and feelings. Following an educational presentation of ways in which trauma affects the survivor and their ways of relating, we opened the floor to discussion on how their partner's way of relating has affected them. Participants tended to want to complain about their partner more than talking about their own thoughts and feelings. The group leader continually had to remind participants to focus on their own thoughts and feelings, using statements like, "I feel blank when my partner does blank," were helpful for the participants. Partners reflected a desire for education on the effects of trauma on a person and how that trauma affects intimate relationships. Again, following an educational session, the participants readily asked questions and interacted with each other. They each shared something they learned, as well as some way in which their thinking has changed toward their partner relationship. This session gave hope to many members. Education revealed relief in being able to explain some of their partner's behavior as resulting from their trauma. Again, education enabled the participants to change their cognitions toward their relationship or partner. Another observation is that discussing sexual intimacy and the physical relationship between survivors and partners revealed pain held by their partner, especially those partners of sexual abuse survivors, indicated deep wounds and possible trauma. Partners of sexual abuse survivors indicated feelings of anger toward their partner's perpetrator, as well as pain over the difficulties of maintaining a sexual relationship with their partner. Once comfortable with the group, the partners found relief in common experiences. As more opened up about their experiences, the others felt more at ease to discuss their own feelings. When this started occurring, more clients were able to reflect their held resentment toward their spouse or the trauma as being the cause of much of the relationship problems. As a result of our group, we discovered that having a clear outline as to what will be discussed helped relieve some fear of participation as well as an understanding of what to expect. Allowing the clients to look at the possible topics of conversation ahead of time allowed some to think ahead and reflect on their experiences prior to group. Also, screening participants or having direct referrals to the group from participating therapists may be beneficial. Because of the many different forms of trauma and the different experience of the spouses and partners, it would have been nice to know ahead of time some of the experiences so we could guide conversation to address trauma and the effects that are more specific to the group. Something that worked well for the group is that having education precede discussion enabled participants to reflect on their own thoughts and feelings from an informed standpoint. They could think about their conditions in light of the new information. Many aha moments occurred out of those education reflection times. For further reflection, it might be better for the group discussion to have single-sex groups instead of a mixed group. We found when talking about subjects relating to sexual relationships, some members would have been more comfortable discussing them in a same-sex setting. Our final results are that spouses and partners of survivors find strength and relief in knowing they are not alone, and that the spouses and partners of trauma survivors are encouraged to continue engaging in personal therapy to help relieve the effects of vicarious trauma. In light of our observations and results, our group has discussed important factors pertaining to how we think it best to facilitate further groups for partners and spouses of trauma survivors. Research suggests that trust plays a large role in the relationships of trauma survivors. Survivors of trauma have difficulty trusting while in relationship. This is carried over to the spouse and causes the spouse to then struggle trusting their partner. This especially becomes prevalent when the survivor's coping mechanisms have had negative influences on the relationship, such as engaging in substance abuse, pornography, or engaging in extramarital affairs. This back and forth of symptoms is acknowledged in research and contributes to the effects of vicarious trauma. Our further recommendations based on research and our own observations is that screening is done before creating a group for partners of survivors. Furthermore, we suggest the groups should be same-sex. We also recommend that all participants are currently seeing a counselor for individual therapy. Another possible recommendation is to limit the group meetings to 8 instead of 12, as long as those involved are also currently under the care of a counselor. Because of the informational nature of the sessions, to limit overload and allow time for processing, limiting the number of meetings may be a good idea.
Ecclesiastes 4:9-10 states, 2 people are better off than one, for they can help each other succeed. If one person falls, the other can reach out and help, but someone who falls alone is in real trouble. The validity of this verse became very evident in multiple ways throughout this group setting. First, throughout the duration of this group members became more aware that they are not alone in their experiences and could then lean on and learn from one another. Second, once spouses and partners learned more about the effects of trauma and vicarious trauma, and then explored their own thoughts and feelings, they became healthier for their spouses and partners who are the trauma survivors. As noted previously, this group served 2 purposes: to educate and counsel spouses and partners of trauma survivors, and in so doing, create healthier support systems for those trauma survivors. While this group proved successful, as Amy discussed, there are areas within the group's success that will benefit from further research and better planning. It is our hope that groups for spouses and partners of trauma survivors become more popular in both supply and demand in order to continue to address the many facets of life affected by trauma.